Hello, everyone, and welcome. Thank you so much for joining us today. I'm Annalise Riles, and I'm the Executive Director of the Northwestern Roberta Buffett Institute for Global Affairs. And as many of you know, we at Northwestern Buffett strive to bring together the brightest minds from across the university and around the world to address critical global challenges that can't be solved from any one disciplinary perspective or geographical perspective alone. We believe that the new genius that this world so desperately needs at this moment is a collaborative genius. And as the problems grow increasingly complex, they demand thinking that transcends traditional silos of expertise and that crosses barriers of language and culture and political affiliation, religion, and so forth. And so one of the ways that we do this is with our research. Our goal is to catalyze research that will help to solve the critical global challenges identified by 193 countries as the United Nations Sustainable Development Goals. So central to this work is our Idea Incubation Process, which is a proven method of successive facilitated conversations among diverse thinkers based on the best social science about where great ideas come from. And this method offers Northwestern faculty and their partners around the world an opportunity to explore global problems and workshop out-of-the-box solutions alongside scholars from other disciplines, as well as practitioners and community partners from around the world. Now, this year, I'm thrilled to report that more than 120 Northwestern faculty from 45 departments and 10 different schools participated in the Idea Incubation Process. And today, we're going to hear from 5 groups that we've selected to receive support to move their work forward. But first, I must take a second to thank all who've played such a critical role in getting us to this exciting moment. First, I want to thank Roberta Buffett Elliott, without whom we would not be able to catalyze and support the kind of interdisciplinary, boundary-breaking research these complex global challenges demand. And I also want to thank our entire board of advisors for their unyielding support and thought partnership, including Honorary Board Chair Roberta Buffett Elliott, Board Chair Fernando Chico, and board members Bonnie Daniels, Sunil Kamlani, and Cynthia Snorf Livermore. And I'm so grateful to share that all of them have taken time to be with us today. So thank you all. I also want to thank Northwestern Buffett's extraordinary research team. Klaus Weber, our Deputy Director, Ariel Schwartz, our Associate Director for Research, Tim McClellan, a postdoctoral fellow at Northwestern Buffett, and Emika Ekwelum, who is a graduate fellow. These 4 individuals have worked tirelessly designing and facilitating the Idea Incubation Workshop process. And you know, this is incredibly creative, intensive work, coordinating and moderating these idea dialogues among participants who usually have never met one another, let alone have a shared disciplinary language for addressing issues, and then supporting them to take risks, to really listen to one another, and to think outside the box together. And thank you so much to all of the scholars and thought leaders from beyond the Academy who made time in this difficult year of all years to engage in open-ended what-if thinking that will make the world a better place. Your openness to forging alliances with faculty outside your disciplines and areas of expertise, and your commitment to bringing about real global change is truly inspiring. Now, last but most certainly not least, I'd like to thank this year's panel of judges who have so generously contributed their time and expertise to this year's process. Our judges this year were Northwestern Professor of English and the Director of our Program of African Studies at Northwestern, Professor Chris Abani, Northwestern University Trustee and Buffett Board of Advisors Chair and Chairman of Promocap, Fernando Chico, Northwestern Foundation Relations and Corporate Engagement Executive Director, Sarah Fodor. Northwestern University in Qatar Dean and CEO, Professor Marwan Crady. And MIT Associate Professor of Law and Development and United Nations Special Rapporteur on the Right to Adequate Housing, Balakrishnan Rajagopal. We're so grateful to you for the seriousness of purpose with which you approached this important decision. And speaking personally, the quality and passion of the discussion among the judges was truly something exciting to witness. So today we are going to hear from each of the judges about this process and from the leaders of the individual projects who will be spearheading these projects going forth. But first, I'd like to share a brief video with you that brings Northwestern Buffett's Idea Incubation Process to life. Now, this video was actually created last year, and so things looked a little bit different this year due to the pandemic and the fact that it all had to be done online. But I think it will give you a sense of the ethos and methods that we use. And you may also enjoy hearing from some of the faculty members whose work we selected last year and who are working on their research under Buffett sponsorship this year. So I'll turn it over to the video now. We at Northwestern University are committed to addressing the greatest global challenges facing the world today. If you think about where a great idea comes from, there is a trajectory from the moment that a researcher has a question, a hunch, all the way to the moment at which a project is complete, research is finished, and it reaches next users in the world. Now, we as universities are very, very skilled at the center piece of that arc. We know how to do the research, collect the data, peer review the research, and so forth. But what about the two ends of that spectrum? Where does the hunch come from? And then on the other hand, how do you bridge the gap from publication to getting that research into the hands of next users? We are committed to figuring out how to make those two pieces of the puzzle work as well as possible. So we at Northwestern Buffett have a three-stage process for incubating and supporting the great research that will impact the world. Any faculty member who has an idea for a research project that could have global impact can simply pose that question on our website. And we at Northwestern Buffett will help to assemble a group of people to have a discussion.
I've been working for a long time on thinking about how do we do transdisciplinary research to solve global environmental problems. So I proposed an idea lunch. As an environmental social scientist here at Northwestern, it can be hard to figure out who are the people that would be your natural collaborators. And so the Institute curated a list of people from all of the different units at the university. I don't know how they did it, but they did a great job of sort of culling through and figuring out who might be interested in this type of interdisciplinary work on global environmental change. And then the Buffett Institute looked for another co-facilitator for the process in addition to myself and suggested Jennifer Dunn from McCormick.
So I got an email inviting me to come to a lunch to talk about disproportionate effects of environmental challenges, and I thought this was a great idea, and I was really curious to see who else would be there, what we'd talk about. So I went to this lunch and we had a really great conversation. What stood out for me is that the need for analysis around costs and sustainability and evaluation of environmental impacts from a quantitative perspective, and that's what I do for my research. So I was excited to see some opportunities to work with people from different fields in that type of area.
Sometimes the group may say, you know, we want to formulate our question more precisely and we'd like to keep working together. And at that point, we move to stage 2 in our process, which is the Idea Incubation Workshop. Now, the Idea Incubation Workshop is a weekend at which the research team comes together at Northwestern Buffett. They have an opportunity also to invite next users, members of civil society or governments or NGOs to join in the conversation and help to incubate the idea. At the end of the weekend, each team presents its research in front of an esteemed panel of jurists. That panel provides great feedback to each of the groups and selects one or more projects for Northwestern Buffett to support.
I was really skeptical of the idea of spending 3 days with people I barely knew and coming up with an idea, but it actually worked for us really well. This intensive focusing forced us to open our minds to new research possibilities.
Over the course of that weekend, I think we all developed a really strong sense of ownership for this proposal, and everybody really pitched in with their best ideas. I feel like we had these pieces in place through these different disciplines to help make our solutions more effective. I found myself really invested in wanting to be selected to take this project and move it forward, work with these people, and make this a reality.
We would really encourage all faculty who might have an idea to reach out to us. It's a simple process. You can go to our website or contact any of our staff. It doesn't have to be a fully baked idea, and we will sponsor an idea dialogue for you.
So the Environmental Challenges Global Working Group you saw in that video launched in earnest last fall, and the group is doing really exciting work, bringing together communities, indigenous communities, into the research process itself, and as co-researchers to identify and address the disproportionate impact of climate change on those communities, finding solutions together. And it's really innovative in the way that it spans such a range of disciplines, from engineering to the social sciences to Native American Indigenous research and much more. So look forward to sharing more updates with you on that group's work in the months ahead. So as it was mentioned in the video, you know, the one wonderful outcome of this process is the kinds of working groups you're going to hear about today. But I also want to emphasize that this work sparks all kinds of individual connections among our faculty that are leading to countless other research and funding opportunities. Just a couple quick examples. This year, Northwestern Professor of Law, Erin Delaney, met for the first time Assistant Professor of Sociology, Beth Redbird, at one of Northwestern Buffett's Idea Dialogues in October of 2019. And although the group for the dialogue didn't go forward, at that meeting, those two found a common interest in Native American tribal constitutions. And so they joined forces to study tribal constitutions in the continental United States. And their work has now resulted in one of the largest collections of tribal constitutions and amendments ever assembled, more than 1,000 records from 304 tribes that span 150 years. And the database that they are constructing will be made publicly available to researchers, allowing other researchers, as well as tribal communities, to map how the process of constitutional development and tribal self-determination has evolved over time. And that project has now received a grant of almost $400,000 from the National Science Foundation. Likewise, last year, one of our Feinberg School of Medicine faculty members proposed an idea dialogue on the issue of falsified medicines. And that dialogue resulted in two faculty members, one from the law school and one from the School of Engineering, meeting up and then teaming up to work together on a year-long project to stop the distribution of falsified medications in Nigeria. And over the past year, amid the COVID crisis, we've held several really important rapid-fire idea dialogues to support faculty in their efforts to address a range of COVID-related challenges, including PPE shortages here in Chicago and around the world. For example, through one of our idea dialogues, a online asset exchange company, Reply, was connected with faculty in our McCormick School of Engineering, and this catalyzed an online marketplace that they created that connects hospitals in need of medical supplies with manufacturers and laboratories. And we also were able to work with colleagues in Mexico on shortages of PPE there. And that work led to a set of best practices for international medical supply sourcing meant to be adapted to a local context. So this is just some of the examples of the, I think, really important work that you're not hearing about today, but that is going on in addition to what we're going to be sharing today. But anyway, let's get back to the winners of our competition. So now it's my pleasure to share remarks from two of the judges who were part of the selection process, Fernando Chico and Sarah Fodor. So turn it over to Fernando and Sarah to kick things off.
I would like to start by saying thank you for invitation to be a part of this process. Thank you, Annalise, and your whole team for a wonderful job. It has been fascinating to watch up close what moves you as a researchers, working to change the world in meaningful ways. I truly admire your work and determination. Each of your projects has incredible merits and definitely the power to impact in its own way. Antibiotic resistance addresses a highly relevant issue that requires prompt solutions in a short time frame. The project on media portrayals of mental health and illness, aiming to change centuries-old biases that build barriers, as does the project on race, castle, and colorism, an issue that has consequences that unfortunately are experienced every day. Having a different approach, less fatalistic, and one we can easily relate to communicate about climate emergency in a much more personal way, an issue that calls for us to respond now. And finally, the project on trauma, music, breath, finding an amazing intersection between art and science to help children, joining the efforts of engineers, music specialists, and other disciplines. And so, whether it's by influencing how we think, changing public opinion, helping people go through difficult times, or advancing healthcare practices, you can all feel proud that all of these steps are achievements that will make the world a better place for all of us. I believe the Idea Incubation Workshop provides you as researchers and the rest of the academic community with an opportunity to address the whole funding process with an open, transparent method that gives way to opportunities to diverse projects in a level planning field. I am particularly excited about programs coordinating different departments. I believe interdisciplinary work opens new perspectives and provides inspiration to address issues with greater impact. When judging, I personally gave a considerable weight to the project's capacity to become international, to be replicated in different nations, so benefits can spread with a wider outreach. That is one of the main callings for the Buffett Institute. I commend your efforts for each and all of the projects. Thank you and congratulations to all. I look forward to seeing your results set to practice soon. Thank you.
Good afternoon. I'm Sarah Fodor, Executive Director of Foundation Relations and Corporate Engagement. I was honored to serve as a judge this year for the Buffett Institute's Ideas Incubation Workshop Competition. It's been really inspiring to learn about these projects developed through the Ideas Incubation Process, which bring together experts from disparate fields to try to solve an important problem in global sustainable development. I appreciated the way the Antibiotic Resistance Working Group addresses an issue that means life or death for vulnerable children and adults, and their range of expertise, including primary care, the indoor microbiome, anthropology, and genomics. I thought a particular strength is that they will build on their relationship with Aga Khan University in Pakistan as a case study, and then may be able to seek federal or international funding to help doctors worldwide make better decisions in prescribing antibiotics. I think that a particular strength of the Climate Emergency and Media Arts Working Group is their idea to share stories of those most impacted right now by the climate emergency to communicate the urgent need for action. Their expertise in filmmaking, environmental humanism, and migration, along with their partnerships in China and Mexico, will help them build networks to address this pressing issue. Mental health is always an important issue, and we know that many have struggled even more with mental health during the COVID pandemic. The Working Group on Global Media Representations of Mental Health/Illness will address this challenge by creating new media to portray more accurately the complexities of mental health challenges. I believe that this group offers considerable expertise in film, anthropology, global health studies, and psychology to reshape global narratives about mental health. In the US, the devastating impacts of racism have gained increasing national attention and outrage this year. The Working Group on Race, Caste, Colorism will explore cultural and social systems of oppression worldwide. This group made the case that sharing representations of similar experiences across cultures can contribute to dismantling systems of global oppression. Key strengths are this group's long-standing expertise in relevant fields of the humanities and strong partnerships in India, Latin America, and the Caribbean. I think that the Trauma, Music, and the Breath Working Group's idea of teaching children to use breathing effectively to process trauma, especially during the COVID pandemic, is creative and potentially cost-effective. I like the innovative high-tech angle of using non-intrusive sensors to monitor breathing. This team will build on their existing global partnerships to develop this approach, which promises to be helpful, not only in recovering from the current crisis, but for anyone facing trauma.
Thank you so much, Fernando and Sarah. And now we're going to hear from the teams that were selected. So just as a reminder, the global working groups will receive up to 2 years of funding, and their support will include seed funding, fundraising support from Sarah and her team, graduate assistance, administrative staff support, communication support, and more. So first up, we have the Antibiotic Resistance Global Working Group, and we'll start with introductory remarks on this group from one of our judges, Balakrishnan Rajagopal.
Hello, my name is Balakrishnan Rajagopal. I'm a professor of law and development at MIT and also the UN Special Rapporteur on the right to adequate housing. I'd like to actually say a few words about the Antibiotic Resistance Project, which is one of the most impressive projects that I've seen in this cycle of funding at the Buffett Institute. The antibiotic resistance issue has emerged in a major way globally in the last few years, as we all recognize that it's one of the biggest threats to global health, food security, and development today. And the problem is widespread. It's an issue that we find around the world, and an issue that affects everybody, people of any age, in any country. We need to understand it more, and we need to understand its impact on many different dimensions that affect us, particularly on health, but also on food security, and more broadly on human well-being, as we understand through the Sustainable Development Goals today. A growing number of infections now are becoming harder to treat, as antibiotics are becoming less and less effective. And I think this project does a wonderful job of trying to frame the issue, to try to develop a multidisciplinary understanding of it, and then to collaborate with institutions in Pakistan and to develop a more grounded understanding of how this problem actually rolls out in other contexts. And I think that projects like these are very important for advancing the course of science and for advancing our attempt to ensure that sustainable development goals are realized for everyone around the world. And particularly timely is this project coming at a time of the global COVID-19 pandemic, as we understand the power of microbes. And I believe that this project will definitely contribute another dimension to our understanding and attempt to deal with this problem. So good luck with this project, and I wish you all the best. Thank you.
Thanks so much, Raj. And now I'm pleased to introduce the leaders of the Antibiotic Resistance Working Group, Northwestern Feinberg School of Medicine Assistant Professor and Anne and Robert H. Lurie Children's Hospital Attending Physician in Pediatric Infectious Diseases, Dr. Mehreen Arshad, and Northwestern McCormick School of Engineering Assistant Professor of Civil and Environmental Engineering, Dr. Erica Hartman, who are here to present their project. Mehreen and Erica, welcome. And before I turn things over to you, I want to remind everyone that we will have a chance to ask questions of Mehreen and Erica and the whole team. So please drop any questions that come to you as you listen to their presentation into the Q&A box at the bottom right-hand corner of your screen, and we will try to ask those. Thanks so much. So over to you, Mehreen and Erica.
Thank you so much. All right, I'm going to share my screen. All right, well, thank you so much for inviting us. I and Erica are very, very excited to be part of this idea dialogue and really thank the support that the Buffett Institute has provided us. Antimicrobial resistance is really a global threat. Within the US alone, this is the CDC report from 2019 showed that there were more than 2.8 million infections caused by antibiotic-resistant bacteria and fungi, with at least more than 35,000 deaths. And then in addition to that, antibiotic use also resulted in Clostridium difficile infection, which is this severe diarrhea that can happen in response to antibiotic use. And there were further, more than 12,000 deaths related to that. And we also know that antibiotic resistance spreads very easily across the globe. Prior to the pandemic, it was thought that more than 1 billion people cross international borders every year, including more than 350 million travelers into the US alone. And so antibiotic-resistant bacteria from anywhere in the world can very easily travel to other parts of the world in a very short duration of time. This was a study that was commissioned by the UK government a few years ago, and they estimated that if antimicrobial resistance continues at the pace that it is right now, and we do not have innovative and effective strategies to counter antimicrobial resistance, we will be looking at around 10 million deaths per year that is attributable to antimicrobial resistance alone by the year 2050. And this will be more than all the deaths related to cancer combined per year, and is certainly significantly more than the 3 million deaths that we have had from COVID in this pandemic alone. So really, sort of getting to the point that if we do not do something about this problem right now, we are going to be looking at a lot more deaths and a lot more problems in the very near future. Unfortunately, a lot of the burden of that mortality is going to be in developing countries, but no part of the world is going to be spared from the severe consequences of antimicrobial resistance. The problem of antimicrobial resistance is not lost on the world leaders. And so in 2016, the UN held this high-level meeting on antimicrobial resistance, and global leaders committed to acting on antimicrobial resistance and to develop strategies. However, as we all know, committing to develop a strategy is very different from actually acting and implementing change. And so there continue to be significant gaps in our global strategy to counter this, this public health problem. In 2019, the UN Ad Hoc Interagency Coordinating Group on Antimicrobial Resistance warned, similar to the UK government study, that if drug-resistant diseases continue at the pace that they are right now, they could cause 10 million deaths each year by 2050. And the damage to the economy could be as catastrophic as what we saw during the 2008-2009 global financial crisis. And they also estimated, in addition, that by the year 2030, antimicrobial resistance itself could force up to 24 million people into extreme poverty due to a number of different reasons, which would include hard to treat and expensive to treat resistance and increasing healthcare costs. Unfortunately, we do know that overuse and increasing use of antibiotics is one of the leading causes of development of antimicrobial resistance. And over the last couple of decades, there has been a significant increase in the use of antibiotics pretty much across the world. There are some parts of the world, such as the US, Canada, where there has been some decrease in the use of antibiotics. But if you look at the map over here, most parts of the world, especially in low and middle income countries, there continues to be a significant rise in the use of antibiotics. And studies have shown again that this use of antibiotics is not appropriate use of antibiotics. So there's really just a lot of overuse of antibiotics without impacting disease in these areas. So really, as we all know, antimicrobial resistance is a global problem, and we really need to have a transnational, innovative, multidisciplinary solution to be able to combat this global problem.
So we acknowledge that this is a global problem, but we have several issues that prevent global solutions to this problem from emerging. One of the biggest ones that we identified is limited access to patient-level data, and that's because different institutions and even different groups within the same institution collect different types of data and format those data very differently. This makes it incredibly difficult to draw general conclusions at the institutional level or higher. So even just within an institution, it's difficult to compare different data types. And since this is such an international problem, it's increasingly difficult every time you sort of go up a level to collect data and make sense of it. Another major issue that we identified is that diagnostic testing can sometimes be more expensive and certainly takes longer than just prescribing an antibiotic. So, if somebody comes in, they're sick, it would take a long time potentially, and potentially more money than just prescribing the antibiotic to help this individual, to just give them an antibiotic. However, the global costs of this sort of decision-making may prove to be short-sighted, and the global burden may be very high given the spread of antimicrobial resistance. So our vision thus is to, I don't know if Maureen, you can advance the slide, sorry. Our vision is thus to create a global collaboration to coordinate responses to antimicrobial resistance across academic, political, pharmaceutical, and medical institutions. This is really a multifaceted problem that involves a lot of participation from a lot of different stakeholders to make achievable solutions. So by using the data that we collect and coordinate, we're hoping to be able to forecast, detect, and prevent the emergence of antimicrobial resistance in communities before it becomes a major untreatable issue. We also hope to clarify the role of existing and new diagnostics and increase their use such that we'll be able to rapidly identify antimicrobial resistance, supporting better clinical decisions about the use of antimicrobials or alternatives, and potentially novel approaches to treating patients, thereby preserving the long-term efficacy of existing antibiotics. So incorporating both alternative approaches and existing approaches. We also expect that by looking at the system as a whole, we'll better understand how people make decisions around antibiotic prescription and non-antibiotic interventions to treat infectious disease. So what's really driving physicians to prescribe antibiotics, what's pushing patients to request these antibiotics, and what types of interventions would be most effective in terms of communicating what we can do about it.
The objectives of our proposal are twofold mainly. One is to develop an infrastructure to evaluate antimicrobial resistance across two different healthcare systems. And so this is going to be a collaboration between Northwestern University and the Alcorn University, as well as the Argonne National Lab. We aim to share existing data on microbiology, antibiotic use, resistance, and clinical outcomes, and then also collect additional patient samples to understand the burden and transmission patterns of resistant bacteria. And then secondly, we want to understand how healthcare providers make decisions around antibiotic prescribing. And for this, we want to be able to conduct interviews and focus groups of community providers, and then design and implement behavioral interventions that are really meaningful and culturally sensitive, and then use processes to monitor how those interventions are working. So our immediate term activities, which are basically in the next 1 to 2 years, are sort of divided into the 3 main categories. One is to share data between 3 individual hospital systems in 2 global regions. So in Chicago, we will be sharing data from Lilly Children's Hospital and Northwestern Memorial Hospital, and then from Karachi, Pakistan, we will be sharing data from the Auckland University Hospital. We aim to develop an electronic standardized data collection system, and then focus on high-risk patient populations and individual clinical settings that may be relevant and may be a high yield for our proposal. We also want to be able to initiate a biorepository of pathogenic resistant bacteria, and then collaborate to conduct whole genome sequencing of these strains of interest, and also develop bioinformatic strategies to analyze these data. And then we want to be able to match the standard resistance testing results that are available in a lot of the clinical microbiology labs across the world to the genetic sequences of those strains. And that will help us in determining the role that sequencing-based studies and surveillance methods can be used in, excuse me, in prevention of antimicrobial resistance. Secondly, we want to conduct a pilot study to understand the burden of colonization with resistant bacteria in patients and their environment. And for this, we want to collect relevant patient samples to determine how many individuals may be silent carriers of these highly resistant bacteria. And then we'll also collect environmental samples from those patients, or samples from the environment of those patients, such as drinking water, hospital surfaces, etc., to determine how many resistant bacteria are found in these patients' environment. And then finally, we want to be able to determine the role that silent carriers of resistant bacteria may have in infecting other individuals around them and or their environment as well. And then finally, we want to study the antibiotic prescription and use in the community. And for this, we want to survey clinicians to discover factors that might influence their prescribing behavior. We will also be conducting interviews of patients and their families to understand attitudes and experiences with antibiotic prescription. And then we want to identify culturally appropriate behavior-based prescribing interventions. And then we want to develop these processes where we can do these interventions and then study the effect of this intervention on prescription practices as well as antibiotic use in the community.
Our long-term goals are, first and foremost, since we've heard from so many people today how important it is to take this to a global scale, is to really expand on our existing partnerships to make this a truly international global effort. In addition, we want to use our increased understanding to take a proactive approach to managing antimicrobial resistance, so that instead of being reactive and changing the way we behave based on existing antimicrobial resistant infections, we're going to establish a forecasting system to be able to issue warnings and suggestions for best practices before these issues get really out of hand. And we will, oh, sorry.
I'm sorry.
And we will develop a model that describes decision-making in the antibiotic prescribing process and can be used to identify the perverse incentives and or time cost trade-offs and suggest systematic changes. So this potentially includes things like changing the interface that physicians use in order to make prescriptions, making it easier to select shorter courses or alternatives to antibiotics, or potentially identifying opportunities to alter the financial models that currently prioritize prescriptions over diagnostics. So in summary, I think we can all appreciate that antimicrobial resistance is a global public health issue, and that to tackle the multifactorial causes of this issue, we urgently need a robust transnational and multidisciplinary approach. And we hope that we've provided infrastructure to get to that approach here. We propose to develop a collaborative effort across academic institutions from 2 distinct global regions with a focus on development of an infrastructure, which we think is critically important for data collection and sharing, We're also collecting pilot data for future collaborative grants, since this is such a large and important issue and we expect to expand in the near future. And we hope that all of this will contribute to understanding antibiotic prescription and use in the community, and ultimately help curb the spread of antibiotic resistance worldwide.
Thank you. Thank you both so much. This was really thought-provoking. Obviously, this is very important and very innovative research. And I just want to remind everyone that I'm sure you have questions. If you have questions, stick them in the chat and we will ask them. So maybe just to kick it off, Erica, the rest, I think some of the other members of your team are here. So let's invite them to join us. Dr. Egon Ozer and Dr. Faisal Mahmood. Egon is an assistant professor of medicine, infectious diseases at Northwestern Feinberg School of Medicine. And we're delighted that Faisal is joining us from Pakistan, where he's an associate professor of infectious diseases at the Aga Khan University in Pakistan. Welcome to you both. And now maybe I'll just kick it off since we have Faisal here. I'd love to hear a little bit from you all about the relationship with Aga Khan University and the partnership with why Pakistan, and how you expect that working on this collaboratively with such an eminent hospital in Pakistan will impact the work that you're doing.
Thank you. May, do you want to go first, and then I can take up from there?
Sure. Yeah. I think it's Pakistan is one of those countries that has a very high burden of antimicrobial resistance in the community, and so I think this is a perfect opportunity for us to learn from really providers and folks and researchers in Pakistan on how they're dealing with some of the antimicrobial resistance, and then also use some of the strategies and the technology that we have in the U.S. to study this global problem that we certainly see in Chicago a lot as well, but maybe not to the same extent as that's seen in Pakistan.
And also, it's a very different environment over here compared to the U.S., where I've worked also. And how these two would gel together is really interesting to see with our unique and combined problems also.
Fantastic. Well, it'll be exciting to see how that develops. That's great. So we have a few questions coming in, and two of them are related. So I'm going to pose them together and open it up to you. The first is, do we know the extent of over-the-counter availability of antibiotics globally? And the second is, I think related, are you interested in looking at marketing practices of pharmaceutical companies related to these antibiotics?
So I don't know if any of the other folks on this panel have an idea about the extent. I can tell you that there is a lot of overuse of antibiotics and over-the-counter access to antibiotics, especially in places like Pakistan and in many developing countries where there isn't a robust healthcare system in place. And we haven't, and I think as part of our community outreach to some of the providers in Pakistan as well as here, I think one of the questions that we will certainly be looking at is how those antibiotics are marketed to these providers by the local pharmaceutical companies.
And I think just to add on to that, not just pharmaceutical companies, but also social media, which is something that Marion had written about also, which plays a huge part in antibiotic prescription here in Pakistan as well.
I think this also speaks to the sort of diagnostic versus drug trade-off, this idea of, if you can buy it over the counter, you don't actually need to go through the diagnostic process. And so being able to understand how much people are doing that and skipping the diagnostic process versus how much the diagnostic could contribute to really ameliorating the entire process, I think that will be really important.
Interesting. Another question is, does the group anticipate that antibiotic resistance will be culturally or socially specific in any way? What differences do you anticipate that you will find between Chicago and Karachi? Do you have thoughts on how you will incorporate this cultural variation into the project?
Yeah, I think that there will be a cultural difference. I think we may be surprised that a place like Chicago may have some of the same challenges when it comes to expectation from both providers and as well as families in terms of antibiotic prescribing for simple things like viral diseases and common colds. And I think one of the interesting things. So I spent 10 years in Durham, North Carolina, practicing and training over there. And the population over there is a lot more homogeneous than it is in Chicago. So we have a very robust immigrant population, many different ethnicities, races. So I think that we are sort of, Chicago is this sort of microcosm of world cultures that I think will be really interesting to look at the cultural aspects of antibiotic use over here. And then I think Faisal, I don't know if you want to speak more to sort of what you might expect in Pakistan.
Yeah, well, so we know that the bugs are sort of different. The resistant bugs we see over here that we see in the US are slightly different in how they are, but culture is an important part. For example, when somebody goes to a general practitioner over here, they expect to get an IV, otherwise they haven't been treated. And that sort of is an important part, and actually has led to outbreaks of HIV in the community also because of this.
Yeah, this is a problem in the United States as well, where a lot of providers want the strongest antibiotic, and it's not necessarily always the appropriate antibiotic, and that can be very culturally based. Sounds like it's maybe a universal phenomenon.
Interesting. So Egon, maybe I'd love for you to say a little bit about your angle on this project, because I have to say, it's the first time Northwestern Buffett, to my knowledge, has had an occasion to engage with the kinds of methodologies that you work in. So what will be your work on this team?
Yeah, my role will be assisting with developing the practices for biobanking, but also specifically for whole genome sequencing of the different microbes that are collected. And the idea being that if we have a better idea of the mechanisms that are causing resistance and how they differ between places like the United States or Pakistan, and what are the predominant mechanisms of resistance, and we'll have a better idea of what we should be looking for when we're doing testing, and whether the antibiotics that are being prescribed, even if they are phenotypically appropriate, whether they actually are when we're looking at what the genotype is, what the actual organisms are expressing. And I think we make a lot of assumptions about what are the predominant mechanisms, but without actually looking at sequences, really going down to the genomic level, we don't really know what distinguishes a resistant organism here from a resistant organism in Pakistan. So by collecting this data and developing methodologies for kind of democratizing how that data is collected and universalizing it, so that what we're doing in the United States is similar to what is being done in Pakistan, I think that we have an opportunity to collect a lot of data that will be very important going forward for understanding transmission of these organisms, mechanisms of resistance, and then really how to develop next generation diagnostics to really understand very quickly what kind of infections are being dealt with and how best to treat them.
Great, thank you. And I should mention that Egon directs one of the centers at the Institute for Global Health at Northwestern Feinberg. And so we're excited to partner with Northwestern Feinberg's Institute for Global Health with this project. We have time for one last question, and it's from Northwestern Buffett Board of Advisors member Sunil Kamlani, who asks, since the issues differ from culture to culture, do you anticipate at all considering including other regions in your study? And also, are you examining access to healthcare, such as public, private, or insurance paid, as a determining factor in overuse?
Yeah, I think that's a great question. I think really we are hoping to use the collaboration that we build through this current proposal to really then expand to other regions of the world. I think some of the, so we have some collaborations in Africa as well as in other parts of Asia that I think we can very easily, include in our proposal once we have this basic infrastructure set up between the current two regions. And then I think that, I'm sorry, I forgot what the second question was.
I think one of the, the insurance, public versus private, I think that falls under the category of factors that we were concerned about in terms of cultural drivers of antibiotic prescribing and people taking antibiotic behavior. So we're absolutely interested in those questions, and the things that we don't get to immediately, we hope to get to in the longer term.
Yeah, I think in our third part of the project, we also want to interview families and patients and really try to understand what their drivers are for asking for asking for antibiotics, even for simple colds.
Okay. Wonderful. Well, thank you all so much. We are thrilled to support this critical work and can't wait to get updates on what you're finding. So thanks so much. So at this time, I'm going to ask the presenters from the antibiotic resistant group to turn off your cameras and microphones. And we will now turn to our second project, which is race, caste, and colorism. And for that, I'm going to ask Professor Chris Abani, one of our judges, to introduce the project. So over to you, Chris.
Hi, good afternoon. My name is Chris Abani, and I'm a Board of Trustees Professor of English at Northwestern University, and I was able to participate in the selection of some of these groups that you're going to be interacting with. I would like to speak to the race, caste, and colorism group to inform you, let you know how important this group is, how amazing the research that will result from this cluster will be, and the sheer global span of this work is not only breathtaking, but unique and very original. It covers the Caribbean through North, South America, across to Africa, and one can argue all of the African diaspora as far as Northern Europe. It spans then through to the subcontinent of India. The breadth of groups it covers is unprecedented in the scope of its study. It's exciting, it's timely, it's original, and the reverberations from this project will continue to resonate within global studies, global South studies, around the ideas of literature, around the ideas of translation for years and years to come. This is quite simply amazing. I hope you enjoy the presentation, and I think you will be pleasantly stunned and surprised by the reach of this particular group, and by extension, the reach of the Buffett Institute at Northwestern, and sort of the extent to which Northwestern University, in all of its ramifications, is becoming part of a larger global network of idea exchange and collaboration that will continue to grow and expand. Thank you.
So well said, Chris. Thank you so much. And now I'd like to invite the group leads for this project, Professor Laura Bruick and Professor Ivy Wilson, to please turn on your cameras and join us on stage. Hello. Laura is Associate Professor of South Asian Literature and Culture in the Department of Asian Languages and Cultures, and Ivy is Associate Professor of English in the Department of English. And once again, I want to remind the audience that if you have questions as they're speaking, just stick them in that Q&A box in the bottom right-hand corner. Thank you so much to both of you for being here, and turn it over to you now to talk about your project.
Great. I hope everyone can hear me. I'm really delighted to be here this afternoon, and I had about 20 seconds to introduce myself, and I won't do that now, but I would like to begin by saying thank you to Buffett and to our colleagues around the university, and especially to Ariel and Mecca. This really couldn't have come together without their collegiality and support and vision. So I want to begin by framing the two dominant questions that really have animated the race, caste, and colorism project. Two questions that we see are ongoing and pressing, and they're the following. How can we think about how color and colorism form the grammars that underwrite various modes of social stratification through the imperatives of caste, racial formation, and coloniality that often create regulatory forms of consciousness, which manifest locally but continue to persist globally? And secondly, how does the persistence of color and colorism not only inflect different world systems of political economies and or the colonial or imperial, among others, but also constitutes itself as a particular world system? As a way of tackling some of these issues, issues that we believe cannot be reduced to simply aesthetics or the superficial or the incidental, we have structured the Race, Caste, and Colorism project as a way to better recognize and intertwine how anti-racist and anti-imperial movements constitute human rights. I can think of no better way to begin our sketch of the Race, Caste, and Colorism project than by turning to the American sociologist and polymath W.E.B. Du Bois, who famously said in The Souls of Black Folk that the problem of the 20th century is the problem of the color line. However, in the complete quote, we can clearly see how Du Bois thought of this problem in the most expansive of terms. The relation of the darker to the lighter races of men in Asia and America, so in Africa, Asia and Africa, in America, and the islands of the seas. So the color line, as Du Bois imagined it, is not simply national, but international, not just local, but global. One fundamental register then of the Race, Caste, and Colorism project is to take Du Bois's oft-quoted maxim and unpack it for its richer critical and political complexity, one that we insist must travel along global routes. Aspects of how Du Bois was thinking about color and colorism are expanded in Black Reconstruction from 1935, where he talks about whiteness as a compensatory wage within uneven political structures. You can see here in this passage where Du Bois is talking about schools and parks, and it's partly how we're thinking about social stratification issues and degrees of mobility. This sentiment was reiterated or echoed by Lyndon Baines Johnson, even a quarter of a century later, in his so-called War on Poverty, where whiteness acts again as Johnson will call it as a kind of theft. And this will all come to a head more recently in a book that was just published last year by Isabel Wilkerson that is kind of hovering in our background of our project called Caste, where she argues that caste, not race, is the bones of inequality in the US. Taken together, these three examples from our perspective animate and really put into high relief how color, caste, and race underline one of the most pressing political questions of our project, and that is whether or not an essentially permanent underclass is necessary for our modern notions of democracy or liberalism. I see in the example of Du Bois not only an epistolary relationship with the Dalit social reformer B.R. Amdekar, as a way to consider, on the one hand, the similarities between Jim Crow segregation in the US and the caste system in India, on the other hand, but also in Du Bois using fiction as a way of imagining new possibilities and new worlds of equality, as he depicts in a later work, Dark Princess. In conclusion, insofar as politics can be said to have been mobilized and deployed, so insofar as politics can have been said to mobilize and deploy aesthetics to underwrite different systems of governance, we seek to accentuate the ways that aesthetics can help us retool the ways that we think about politics.
Okay, can everybody see the screen? I hope. Okay, I should probably be in slideshow mode, but I'm not. It's okay. All right, our ambition is to cultivate a global network of scholars, artists, writers, translators, and activists around a shared political, intellectual, and aesthetic inquiry of race, caste, and colorism. We want to help foment not only an institutional and intellectual shift in the ways scholars and writers think about local manifestations of caste and casteism and racism as part of a global semiotics of colorism. We also want to create key moments of intersection and connection for leading and emergent artists and scholars and writers engaging with the history, present, and future of race, caste, and colorism, cultivating a new transnational field of political and intellectual exchange. We consider our activities in a series of broad categories. First, if I can get to the next slide. First, we have translating and publishing activities. We seek to develop a culture of translation in a myriad of ways, one of the most concrete of which is by working to develop dedicated publishing channels and co-publishing partnerships among presses in the Americas and India, which would prioritize the following kinds of texts. First, newly annotated classics from 20th century Black, Latinx, and Dalit intellectuals. Second, new scholarly monographs and anthologies of cutting-edge research. And third, original urgent literary works and works in translation to and from English by writers of color and marginalized castes. One of the project's overall aims then is to open access to the foundational texts that help us contest problems of contemporary racism and casteism. Dalit literature, for example, today constitutes one of the most vibrant and interventionist bodies of literature in modern India. A radical literary movement founded in the 1970s by the Dalit Panthers, a collective of activist poets in Western India. Dalit literature in India has long engaged explicitly with the protest and liberationist politics of African-American aesthetics, though it remains little known in the United States. And the circulation of contemporary Black literature in India is limited to predominantly elite classes with access to English. A co-publishing and co-curating collaboration between US and Indian publishers will create new avenues for exchange, bringing contemporary African-American voices to an Indian audience and translating Dalit voices for an American one. Our goal of calling on our colleagues in academia to reorient their scholarship around the global colorist regime, akin to the transformative political reorientations of scholarly work brought about in recent decades by collectives organized around subaltern studies, decolonial studies, etc., necessitates the creation of interventionist scholarship and the convening of influential race, caste, and colorism roundtables, symposia, and conferences. We plan to do this in several ways: building capacity on a local level with reading groups and works in progress workshops, convening scholars of race and caste on a national level by organizing roundtables and seminars at conferences such as the American Comparative Literature Association, and marshaling a transnational scholarly collective by hosting a significant conference that will convene leading humanities scholars of race and caste from the Americas and India, with the plan of developing an intellectual manifesto and foundational publication of scholarly essays that will define future imperatives of intellectual inquiry. Focused pedagogical initiatives also fall under this category. These include seeking enduring funding to establish institutional footholds for the intersectional study and pedagogy of race, caste, and colorism through the establishment of institutional opportunities for emerging scholars, such as dedicated graduate fellowships, postdoctoral and faculty positions. In the more immediate term, we will develop new courses that can be collaboratively taught by faculty at Northwestern and in partnership with faculty elsewhere, and we will collect existing open access pedagogical resources on a dedicated website to enable curricular expansion more globally as well. Our long-term goals also include the creation of artist, writer, and translator residencies at Northwestern, as well as shorter-term focus workshops for transnational artists and writers creating original work around the themes of race, caste, and colorism. In these facilitated sessions, writers and artists can develop critical local community connections and reflect on the intersection of aesthetic representation with questions of race, caste, and colorism. Working individually and together, they can create novel projects that critically address the lived experiences of social justice and inequality and envision alternative futures. The professional mentorship, focused reflection, and deep interpersonal and creative connections these workshops will foster will create opportunities to catalyze exciting new voices and works of art, while also fostering critical community dialogue that can contribute to dismantling entrenched race and caste-based hierarchies. In the shorter term, in order to move towards this longer-term goal, we will host a series of more locally focused storytelling workshops that will engage students, faculty, and community members in guided and collaborative narrative exercises to establish a shared space for translating lived experiences into the creative catalysts for transformative art and literature. So I just want to join Ivy in thanking the Buffett and thanking the panelists and thanking all of you for listening to us today.
Thank you so much. This is so exciting, and obviously the scope is tremendous. Again, folks, I'm sure there are lots of questions. Please put them in the chat and we will pose them. Maybe I could just open it up by asking you about the transnational dimensions of the project. I mean, one of the reasons we think this is so important for Buffett to be engaged in is because you're putting questions that many Americans think about in a national framework in a much broader perspective. And I wonder if you could talk a little bit about the longstanding connections between movements in this country and in India, and how you see this as another step in that work, or how you think about the transnational and the comparative and what it has to decenter.
First, we have our other panelists here,
yes,
Emily and Kalyan.
Absolutely, they are here. Please, everyone, join us. So we have, thank you so much. Let's see, Professor Emily McGuire, Professor Kalyan Nadiminti. Anyone else? Yes. Thank you so much for joining us.
Yeah, well, I can start, and then Annalise with your question, and then anyone else should jump in. But one of the things that we talked about frequently amongst ourselves during the incubation workshop was to think about how we can take these kind of storied moments of interconnection, which have been significantly understudied, but of which there is some sort of recognition of these moments of interconnection of the 20th century between Du Bois and Ambedkar, for example, or between Martin Luther King Jr. and Gandhi's family, where you have these moments in the 20th century of major sort of political and intellectual leaders in both places coming together and seeking information from one another and seeking the understanding that comes through these kinds of comparative conversations. And then you also have, and we brought up the example of the Dela Panthers, you have these 20th century moments of the intersectional influence of anti-racism and anti-casteism inspiring art and creativity in both places. And I think that one of the things that we talked about, however sort of grandiose this may sound, I think that we are interested in fomenting a 21st century version of these key moments. How can we bring people together, now, about whom people will be writing and responding to for decades to come? And I really think that is something. It's a big goal, but it's something that we're particularly excited about pursuing.
And Alicia, on the question, thank you for the question too. On the question of the comparative or the transnational, to say a little bit more on the comparative, in a kind of hyper-local sense, we have been kind of unduly sensitized to the ways in which Blackness kind of circulates in the US imagination. But that circulation does have a global context. And so we're looking at the differences and the similarities between how other polities and cultures think about culture and think about color as a way to suture communities, but also sometimes cleave them and keep them apart. So there are numerous examples that have come up in our conversations, including, historically speaking, that between the Irish and the English, ostensibly sharing the same skin, but having been cleft through imperialism, the both apartheid regime in South Africa, variegated color schematics in the Caribbean, and the like. And so we see color as not simply a kind of hyper-local U.S. issue, but as one that underwrites different political systems across the world. And it's worth bearing out how those models and the differences get borne out in a comparative perspective.
Okay, so another question that we're getting is about translation. And indeed, I think what the judges thought one of the most innovative aspects, there are many, but one innovative aspect of your project is this focus on the importance of translation. And I wondered if you could talk a little bit about that. What are the stakes of focusing on translation for you? Why did that become a place where you wanted to put so much energy? Because we know it is hard, it's time consuming, it's expensive, it's really difficult. And likewise, we have a question from Professor Candy Lee, who points out that unfortunately Americans don't read in translation as much as they should, probably. And is there a need for a kind of, these are my words, a decolonial marketing strategy or something? How do we get people excited or engaged with these works once we get them translated?
I'm going to let Emily field that one first, and then first I was going to make a joke about how all the translation I've ever done has been for free, so I don't know how expensive it is, but first, given that, I'll pass it over to Emily.
I actually think that there have, I want to contest the notion that Americans don't read in translation, because I do think that there have been significant moments when we do and when we have, and in my field, the Latin American boom being one such moment, right? The literature of writers like Gabriel Garcia Marquez, Jose Donoso, Isabel Allende in the 70s, who began publishing in the 60s but arrived here in translation more in the 70s and 80s, was a real kind of watershed moment. I also think that we're seeing a moment in publishing where, significantly in the US, but I would say also in other parts of the world that I work with, where we're seeing that the launching of many different small presses that have brought the translation of younger writers to the fore. So I think there are quite a number of young writers that are being translated earlier, being discovered more. So I think we would want to capitalize on that. I think for these kinds of dialogues, translation is fundamental, in that if you don't know what someone else is, if you can't read what someone else has written, what someone else is saying in another linguistic context, in another continent, they may be saying something deeply fundamentally in dialogue with what the problems you're working on. But if you don't know it's happening because you can't read it, then those dialogues don't happen. So, some of the moments of transnational and cross-cultural encounter that Laura was referring to happened because of translation, because works were translated or were available in a readable format and someone read them, right? So I think our idea is that without that culture of translation, some of these encounters really just aren't possible.
Anybody else?
I guess I'll also add that, one of the things that does sort of power our project is sort of how historically so much of the sort of intersections between race and caste have happened through acts of translation, whether it is sort of how the Black Panther Party's sort of manifesto gets sort of re-upped in the Dalit Panther manifesto. Laura sort of showed a picture there earlier where you actually had like the Dalit Panthers poster that was written in Hindi. And so you have these like acts of translation that are actually already powering the very process of thinking about race and caste historically. And so a lot of what this project is attempting to do is tap into that, that historical sort of zeitgeist, if you will, and to kind of bring it in conversation with many of the sort of anti-racist, anti-caste, anti-imperialist conversations that are happening in this particular moment.
And I might just jump onto that for another brief moment, just to say that, you know, one of the ethical values that we bring to this project is that of trying to make everything as open access as possible. And, you know, we can't exist only, you know, we can't do this work only in English, right? We can't do this work only in a sort of Anglophone world. And so I think we're thinking about translation not only as unidirectional, but ideally as multi-directional. And so how can we, you know, there's clear desire and evidence. I mean, we've been talking already about the Dalit Panthers, but, you know, among Indian writers, Dalit writers, to access the works, the contemporary works of Black writers in the United States. And if they don't speak English, they can't. And so, and most of these writers are not writing in English, not working in English, and not reading in English. And so how can we create, you know, what I referred to earlier as a culture of translation that is not only a kind of interlingual mode of just thinking in multiple languages and making material accessible in multiple languages, but how do we think about, you know, the way in which we operate on a day-to-day basis as being in a kind of translational mode.
That's so fantastic. And just mention that it's one of the pillars of our new global strategic plan for Northwestern to become a multilingual university, because conversations are different when they're in multiple languages than when they're only English. Absolutely. So we have a question from Marcela Pizarro asking, is there not an argument for a translation project that bypasses the so-called global north entirely and establishes a different kind of traffic flow? For example, Arabic text to Spanish text. So an obvious example is Edward Said to Spanish, or Jose Carlos Mariategui, a Peruvian Marxist critic, to Arabic, and so on. So any thoughts about that?
Yeah, I can offer some preliminary comments from the kind of from the global Black perspective. This is a kind of ongoing debate on the continent, and it was really came to a head about 50 years ago in a debate between Chinua Achebe from Nigeria and Ngugi from Kenya. And Achebe wrote that it wasn't so much speaking in the master's tongue, but it was the language of his imagination. And that's what it really boiled down to for Achebe versus Ngugi. And Ngugi decided to not write in English, and had to make a decision about whether or not he was going to write in Kikuyu or Gikuyu, and it had serious repercussions to his kind of party affiliation in Nigeria. But Ngugi was such a world-renowned writer at the time, he knew that even if he wrote in a native tongue, so to speak, it was going to be immediately translated into English. And I'm trying to sketch an outline here, because there is a second and third and fourth level order of English that doesn't necessarily have recourse to England or the US. In this case, there is a version of French, and there is a version of Arabic, and there is a version of French that circulates in the continent, that is in the way that Homi Bhabha has described it, not quite, but almost. And it's that not quite part which has enough nuance, enough texture, enough difference that it can function, those languages can function as lingua franca on the continent, or even across the Black diaspora in Jamaica, in Kenya, in Nigeria, ostensibly using the frontispiece of English as a language, but really having subtextual nuance and meanings that belie standard English.
Fantastic answer. Emily, I'm wondering if you have any comments from the point of view of the Caribbean on this issue.
I mean, I would agree with Marcela that there is an argument to be made for texts that bypass the global north, and I think when we envision translation projects, we aren't simply envisioning everything into English or vice versa. That said, as I think Ivy's answer reveals, the complexities of the questions of linguistic context. So I think our goal is to create as Laura was saying, a culture of translation that really facilitates dialogue in multiple directions. So obviously how we go about that and the directions that flow will have in some ways to do with the ways in which we're able to bring partners and resources on board. Laura, I don't know if you want to add something to that.
No, great. Well, this is all really interesting and extremely important, and we're just so grateful to you all for being willing to partner with us to do it, and we're excited to see what comes next. So thank you so much for being here today, and thank you for your work, most of all. So at this time, I'm going to ask this group to turn on your cameras and microphones off. And now we'll move on to the next group, which is our music, trauma, and the breath group. You can see we have very different methodologies under our umbrella at Buffett, from science, the humanities, and now music, engineering, and to some degree, psychiatry and psychology. So for this, I'm going to ask Northwestern in Qatar Dean, Marwan Crady, to introduce the project. He was one of the judges and is going to tell us a little bit about it. So over to you, Marwan.
Hi. One of the great proposals that we were fortunate to evaluate for the Buffett Idea Incubation Workshop was a project on music, trauma, and the breath. The project gathers an interdisciplinary team of scholars, of musicians, of clinicians who are exploring ways for how to make music more of a healing force globally. Personally, as a scholar of media and politics who has focused on embodiment and activism for social change, for example, I was very intrigued by the central role that the breath plays in this project. I think this was one of several original intellectual contributions of this project that I found appealing. It was a pleasure to discuss the project with its leaders. We discussed how the project's global conception can be deepened and its global impact expanded. I learned more about trauma as a global issue and how music can help heal it in a variety of contexts. I really liked the fact that the project leaders identified concrete practices that led to concrete outcomes aligned with the United Nations Sustainable Development Goal, number 3, global health and well-being. I also really appreciated the project's ambition. The ultimate objective is nothing less than the creation of a Northwestern University Institute for Music, Health, and Well-being. This will entrench the knowledge gleaned from the project into an institution and contribute to Northwestern's positive impact locally and globally.
Thanks so much, Marwan. And now I would like to invite the group leads for the music, trauma, and the breath group, Heather Arani and Sarah Bartolome, to please turn on your microphones and cameras and join us. Hello, nice to see you. Heather is a faculty member at Northwestern's Farley Center for Entrepreneurship and Innovation. She's also a renowned conductor, soloist, and performance and voice expert, as well as music educator. And Sarah Bartolome is Associate Professor of Music Education at Northwestern Bienen School of Music. Thank you both so much for being here. Just remind the group again to put your questions in the Q&A box for them. We'll have a chance to chat about after their presentation. So over to you, ladies.
Thank you. Thank you to Associate Provost Riles, Dean Crady, Roberta Buffett Elliott, the Buffett Institute, and our esteemed judges for your vision, leadership, and support. I am Professor Heather Arani. I work in entrepreneurship and innovation here at Northwestern, and I am also on faculty with the Lyric Opera of Chicago. I'd like to also have my co-lead introduce herself.
Hello, my name is Sarah Bartolome. I am an associate professor here at the Beanan School of Music. I'm a specialist in music for children, ethnomusicology, and qualitative research, and I am honored to serve as co-lead for this project.
In my work as a teaching artist at Lyric, I have been extremely fortunate to combine my various areas of expertise: child development, breath, singing, innovation. If you would, please join me in a trauma-informed breath practice, which I have done with hundreds of children throughout Chicagoland. The first thing that I'm going to ask you to do is slouch and breathe on your hand and notice the temperature. Is it warm? Now I'm going to ask you to sit up like you want to be 2 inches taller and breathe on your hand again. What is the temperature? What did you notice? Typically, when we are in alignment and our resonance, like we want to be for singing, the breath cools. In addition to preparing a child for singing, it also deeply connects a child to their body. I did this activity with a group of second graders at the beginning of a rehearsal. And there was this adorable little second grade boy who did the exercise and afterwards participated verbally, actively throughout the entire rehearsal. And the teachers were shocked because they had never heard him speak before in school. In fact, it was one of his learning objectives to be able to speak in school. And this led me to question why. Why is breath and music so powerful and such an incredible tool? And how can we come together in our various disciplines to develop systems and strategies to maximize the impact that music and rhythm can have on the body? That question is what our incredible team has been working on for the last year.
It was clear from the beginning that the global nature of trauma made this project a good fit for Buffett's Idea Incubation Program. Not only is trauma recognized as a global health issue, the consequences of the global interdisciplinary pandemic, experts assert that it is a global problem best served through the kind of interdisciplinary international collaboration that is at the heart of the Music, Trauma, and the Breath initiative. When we first convened for the Idea Dialogue in June of 2020, I don't think any of us really recognized how relevant our project on trauma would become. Since that time, experts have concluded that we have experienced pandemic-related trauma on a global scale. More specifically, emerging research in psychology, psychiatry, and from the CDC highlights the way the global pandemic has caused developmental disruptions and trauma among children. The trauma of increased exposure to abuse in the home, neglect, food and housing insecurity, interruption in schooling, and reduced socialization may have long-term effects for children. Music, Trauma, and the Breath team member Dr. Benjamin Gorvine will explain.
There's lots of emerging evidence that we're all witnessing about the developmental disruptions that are occurring for children, particularly elementary school age children, as the pandemic has gone on. And I'm really interested in working with this group as we examine ways that we can utilize music as a kind of methodology to help children through these developmental disruptions. The good news from my perspective as a developmentalist is that we know that children and development is very plastic, so that plasticity in development and that flexibility predicts that there are a number of things that we can do to intervene and improve outcomes and help children through the trauma as we begin to emerge globally from this pandemic.
The children who have endured this pandemic are now being referred to as Gen C, the COVID generation. Our team has identified Gen C, specifically children in kindergarten through 5th grade, that's roughly ages 5 to 11, as the target population for our project. Our intent is to develop a research-based musical intervention that will help Gen C children around the world process pandemic-related trauma. So the question then, why music? In addition to scores of anecdotal stories like the one that Heather shared with you today, there's a growing body of research documenting the power of music for health and well-being. Around the world, dedicated research centers are investigating the physical and mental effects of music. Here in the United States, the National Institutes for Health have partnered with the Kennedy Center to sponsor the Sound Health Initiative, which recently committed $20 million to research that will advance evidence-based music intervention for brain diseases and human health overall. Yale and USC are among recipients conducting interdisciplinary studies on the effects of music on the body and the brain. We aim to build on this body of research, utilizing group singing, rhythm, and the breath as an intervention for mitigating pandemic-related trauma experienced by children and contributing evidence of its effectiveness. We believe our interdisciplinary team is positioned to emerge as a global leader in this area. Our core team includes experts in engineering, trauma, psychology, child development, music education, ethnomusicology, and singing in the breath. We are also actively collaborating with other key stakeholders, including experts in biomedical engineering and neuroscience. Our team draws in faculty from 6 different NU school units and aims to leverage critical interdisciplinary expertise to design a powerful musical intervention and examine the effect of that intervention both behaviorally and biomedically. The TNB initiative is anchored by 3 core values: interdisciplinarity, global impact, and cultural responsiveness. With these values in mind, we developed a 2-pronged approach. On the practical side, we will design a culturally responsive musical intervention. On the research side, we will design an international multi-site research study that will gather evidence of the effect of that intervention. During year 1, we will gather information, completing a comprehensive literature review and making site visits to observe existing music for trauma approaches. We will also organize team trainings in trauma-informed and culturally responsive practices. These activities will inform the design of the musical intervention. We will also pilot our intervention locally and identify potential sites for year 2 research. Importantly, we will work closely with one of our key contributors, Dr. John Rogers, to determine how to collect biophysical data using wireless wearable sensors that non-invasively measure things like vocal activity, heart rate, and cortisol. TNB team member Teresa Brancaccio has an existing collaborative research relationship with Dr. Rogers.
In 2018, I designed the Singer Savvy app, and currently I'm conducting a study on quantifying vocal fatigue with Northwestern's own John Rogers. Central to our study is John's groundbreaking wearable technology. These devices would also be an important part of the Trauma, Breath, and Music initiative.
I made the proposal that we could actually measure cortisol levels, which become naturally elevated during times of high stress in the human body, using John Rogers technologies. My proposal is that we leverage that technology, combine it with the research that's being proposed on measuring stress and the impact of music on stress, so that in essence the subjects could have these sensors measure the cortisol levels, measure the stress levels, assess the impact of various types of music and deep breathing therapies.
Well, hello, my name is John Rogers. I'm on the faculty here at Northwestern in biomedical engineering, and I'm just recording this short video to express my enthusiastic support for this interesting project on music, trauma, and breath. My own expertise is in advanced biosensor technologies, such as this particular device, which mounts at the base of the throat to capture vocalization and capture patterns of breathing. And I think this kind of technology can be very valuable for the broader collaborating team. And I look forward to working closely together on this project in a collaborative way that would bring engineering expertise to this overall effort. Thank you.
These brief testimonials demonstrate how we have been able to leverage our Northwestern network to generate feasible ideas to move the project forward. Year 2, our team will design a research study to measure the impact of our musical intervention, integrating a behavioral qualitative research component alongside the biophysical data collection. After securing IRB permissions, a local pilot study will precede the launching of data collection at 2 global sites. We have already begun reaching out to our existing international network, shown here, to explore possibilities. In fact, Dr. Lee Higgins, founding director of the International Center for Community Music in the UK, has already invited us for a site visit, and his colleague Catherine Birch, a specialist in trauma-informed community music, is excited to support our work both in designing the musical intervention and in collecting data on the ground. We highlight this relationship as one example of how we have already been able to mobilize our existing network to move toward our project goals. The generous support of Buffett Institute will enable us to accomplish these important objectives during our initial 2 years of activity as a global working group. As we build on the work of the first 2 years, we have a number of longer-term goals. We intend to disseminate our work, increasing our global impact through publication and the design of pedagogical materials, training programs, and curricular change. We intend to expand our work, adapting our musical interventions and research protocols for use with other populations processing many kinds of trauma. We also intend to continue to build capacity. We envision Northwestern University as the driving force behind a global research network, and we believe that these 2 years of Buffett-funded activity will position us to successfully seek external funding. Ultimately, we aspire to create an institute dedicated to the interdisciplinary study of music, health, and well-being here at Northwestern University. Through the Idea Incubation Workshop process, we have crafted a vision of a collaborative, interdisciplinary project that targets the issue of childhood trauma. We have harnessed our collective expertise to design an international research plan that is both feasible and global in scope, one that responds directly to the traumas of the recent global pandemic and broadly addresses the United Nations Sustainable Development Goal number 3, good health and well-being. With the critical support of the Buffett Institute, we look forward to fully realizing these ideas and making a meaningful and lasting contribution to our global community.
Thank you.
Thank you so much, Heather and Sarah, for this really exciting presentation. I'd just like to invite another member of your group, who I understand is here, Dr. Ben Gorvin, to turn on your camera and join us. Hi there, Ben. Ben is Assistant Chair and Professor of Instruction in the Department of Psychology. And so now we are open for questions. And let's see, the first question was about how do you plan to work with global partners? Why does this need to be this problem need to be addressed in a global perspective? And what do you think you've gained from working with global partners to think about this?
Well, first of all, thank you for that question. I think it goes to the heart of how important this process is. And I'm so grateful to Buffett for being so intentional in the conversations and planning. It's extremely important that we are not entering communities and telling them what to do, telling them what music is, telling them how to breathe. It's a collaborative relationship. And so from the beginning, there needs to be a very intentional aspect in terms of listening and a relationship of equals. I'm going to bring this over to Sarah, who is a world ethnomusicologist Fulbright winner, to talk a little bit more about this.
Yeah, I think, to answer your question, why does this need to be a global study, right? So I think the establishment of trauma as a global problem on the one hand, and then the nature of music as a global human phenomenon on the other hand, it makes sense to kind of combine this problem with the solution that's so ubiquitous in our world. And so our team really feels like we have something to contribute on a global scale, that this problem first focus on children, Gen Z children, but largely the idea of folks processing trauma all over the world, that music could be a wonderful intervention that could improve the health and well-being of people everywhere. And for that reason, it makes sense to have this kind of international approach.
Part of our hypothesis is that music serves there's an evolutionary reason why we sing throughout cultures. And I'm going to hand this over to Dr. Gorvin to talk a little bit about why we focused first on children and the plasticity that we know throughout a lifetime, but especially children have in terms of neurologically. Could you speak to that, Ben?
Yeah, I think our thinking was that certainly there are huge impacts of COVID for 5 to 11-year-olds. And so it's a population that's in need of attention. But we thought kind of along with the trauma and the negative impacts, it's also an age range where there's lots of evidence from psychology, from neuroscience, that there's an enormous amount of flexibility and plasticity. And so there's this big opportunity as well to intervene and to improve outcomes. And the one other piece I would add is, from the standpoint of psychology and social science research, there actually has been shockingly little work looking at music as an intervention in a systematic way. It's always kind of an afterthought in the literature, where there's this idea that it's a good adjunctive treatment, but it's not something to be looked at unto itself. So we thought there was a real opening as well in that regard to really expand the literature and do something more rigorous.
Super interesting. So I think one of the things that the judges found really exciting about your project was that it brings together just an unbelievable diversity of scholars, right? You have people building sensors, you've got quantitative data folks, we've got ethnomusicologists like Sarah, performers and educators like Heather, people who are in the innovation space, people doing psychoanalytic work. So can you talk a little bit about, how did that work? Was it difficult? How did you all find that conversation among so many different fields, people who usually don't talk to each other?
So thank you for that question. As you know, I work in innovation and entrepreneurship. So part of what I do is bring together people from different skills. That's a core philosophy in terms of building a great team. It's very in line with Buffett that if you want an incredible team, you need an incredibly diverse team collaborating with each other. And so I want to acknowledge Ariel's important contribution in helping us locate people from different disciplines to come together who would be aligned, who would have something to contribute. And that was something that when I reached out to people and I would speak with them about the project, I think it was very clear that this was something really important. This was something that could only happen within the last several years due to the latest advancements in engineering and in medical technology. And so I think there were many people who were excited to come on board. And I again, like, I did not know Sarah. I did not know Ben. And so being able to connect with these brilliant, phenomenal faculty members has been amazing. Sarah, could you speak to what it was like for you to enter into this? And then Ben, about your why. Why did you commit your time and brilliance to this project?
Yeah, I think one of Buffett's slogan, the future is collaborative. I think that's 100% true. The nature of this project requires all of those expertise, Annalise, that you mentioned. And in fact, if we look at some of those studies that are getting funded by NIH, like the one at USC and the one at Yale that I referenced today, we're really seeing this integration of behavioral and biophysical, biomedical kinds of measures, so that we're getting this kind of like more holistic picture of different kinds of interventions. And so I think that we're kind of on the cutting edge of this type of research that draws together some of that medical pieces with the sociological, behavioral kinds of pieces. That's really powerful. I will say Heather and I never met in person until last Friday. So talk about doing all this work in a pandemic. I will say one of Heather's superpowers, one of her many superpowers, is bringing people together and getting people on board. And so the fact that not only is this an incredibly diverse team, but that it got pulled together in a global pandemic where nobody even met face to face is just really remarkable, and a testament to her skills and to the power of Buffett to kind of inspire this kind of integrated collaboration.
Thank you, Sarah. Ben, do you want to speak to your committing your time and brilliance to this? And thank you, Sarah.
Sure. I think I would just add, really echoing, it's really exciting to get out of academic silos. So for me, being able to collaborate across schools, not just across departments, but really across schools, McCormick, Beaman School of Communication has been a fantastic opportunity. And for me, I also got pulled into this project by Melissa Foster, who's in School of Communication, but I know her through a totally different pathway, through being a faculty in residence. So it's really nice to be able to kind of expand out in that way.
I'm so glad you mentioned Melissa too. Melissa, I think is on with us now, because amazing, she's not in the, so hi, Melissa. Amazing people tend to know amazing people. So people would say, well, as people got to experience the power and brilliance of Buffett and the amazing work, they would say, like, I know someone in this discipline, and so it really built on itself. So thank you, Annalise, for everything that you do.
So we have a really interesting comment, more than a question, from one of our listeners, Hideko Tamura, who is a Hiroshima survivor, bombing survivor. And he comments, he says, it's so interesting that trauma is being addressed by using music. I remember a couple of years after the dropping of the first nuclear bomb in Hiroshima, a youth choral group taking the theme of hope and singing as a way of addressing that trauma. I just think it's a lovely, lovely comment. So
very powerful.
Okay, we have a question here from Trevor Nicholas. He says, this is absolutely amazing. and hope-filled collaboration. How might this work help us to narrow the equity gap in communities across the world? Is there hope to impact education funding and policies down the road?
Oh, thank you for that. Thank you for that. Yes, that is one of our key goals. I think if we look at, and Sarah, you can speak to this more. I think oftentimes, and this is part of my deep passion for this, I think oftentimes people who are not musicians, who do not have, they do not realize how powerful and imperative it is. I often say, if we want students doing well in school, if that's all you care about, you should still be doing music. Like, even if you're not gonna, and so I feel like the music budget is one of those things that often gets cut, you know, that is often, oh, well, we don't have room for that. And so part of my deep hope is that through this multidisciplinary collaboration, through the data that we collect, it will be very convincing to people in a different way about how incredibly integral music is. And it will be like math and English, or whatever language you're studying in your global community in the schools. And so thank you for that, Trevor. Sarah, Ben, if you'd like to say more about that.
Yeah, I'll just say I'll just tilt it a little bit. The idea of issue of access and equity related to these kinds of interventions. So we had a lot of conversations about, well, how is this like music therapy? How will it be different than music therapy? And we talked about the ways that a musical intervention is more accessible, can be done with larger groups, could be in the future mobilized to schools all around the world. We kind of aim to develop the tools that we could then deliver to community leaders, to school counselors, to educators, to principals and administrators, and that these interventions could be deployed on a larger scale to serve more folks who may or may not have access to other kinds of interventions as they're processing trauma. So there's definitely an access piece that's on our minds as we develop the project going forward.
And then not all children are in schools. That's a key part. When we were looking at the technology, we don't want to have the assumption that kids are in schools, you know, and so that's been a really important part of the narrative, and why it's important to have so many different disciplines saying, oh, well, here's what we could do if they're not in school. Here's a way we could bring it to the community in this way or that way. Ben, did you want to add anything?
I think the only other thing I would add is that I think in a lot of our conversations, we talked about the different levels at which music works, so that there's kind of a physiological level that we can be examining, but there's also the level of meaning, and that music exists across all cultures, so that there's really an opportunity to look at this globally.
And in addition to Melissa, I just want to acknowledge we have other team members who are tuning in, and I just want to say the team was phenomenal. You know, just so that slide that we have with the team that truly, you know, this process was everything that we know about how to really create amazing change, how to pivot, how to maximize the talent that we have at Northwestern. And I originally thought of this too, because Lyric did a huge article on my work, and Francis Collins was quoted in it talking about it. And as a graduate of Northwestern, as a professor at Northwestern, I thought we should be doing, like, no one is better than us at doing this. Like, we have phenomenal interdisciplinary people at Northwestern. And so this institute, I think, really will be, we have the great potential here for something phenomenal worldwide.
Very exciting. So we have two questions here that I'm going to put together because I think they're related. One is from Professor Drew Davies from the Beaton School of Music, who says, I'm curious about what kind of musical activities work cross-culturally and globally, given that you're dealing with children in different backgrounds. And likewise, Patrick Eckles from the Northwestern Buffett team says, you know, I know that you're going to go through more design process to establish the musical intervention, but can you give us an idea of what that could look like? Like, what instruments? Is it going to be popular music, classical music? What kinds of assumptions about music did the group settle on to make this work? Yeah.
Oh, thank you for that. So that is a key part of what we're doing in this first 2 years. And so I'm going to hand this over. We are not going to come in with this is my music in my language, and now I'm going to teach it to you. That is against everything that this project is about. So I'm going to hand this over to Sarah to talk about the questions that we are researching with this very important 2 years of funding.
Yeah, it was a critical part of our discussion all through the whole development process. One of the things that's really key is the development of really sustainable global partners with whom we'll work to adapt the intervention, ensuring that the music, the style of music, the kind of music making for cultures, for example, where it may not be possible for people to sing. How do we use breath, rhythm, other kinds of music making to access the same kinds of benefits of the intervention? So we're going to really be relying on the relationships that we develop with those global partners to advise us on that. We're going to develop something locally with our own understandings of our local community. We're going to pilot that, and then it's going to be something that will be adapted to each of those global sites. Similarly, just along the same vein, the research protocol itself, how we measure and collect the data, we're going to be relying really on those global partners to work with us to make sure that the research protocols are also culturally appropriate, culturally responsive to the communities with whom we wish to work.
We had an important conversation with Dr. Jeffrey Roth out of U of Chicago, who does a lot of global work in groups on how do you enter spaces? How do you not colonize when you're doing research? And so these are, the last thing that we want is, okay, let's go do this work on trauma and then leave and, good luck. We want to be so thoughtful every step of the way. And this process of bringing together multidisciplinary people enables us to do that by giving us this critical seed funding so that we can be so intentional every step of the way in laying this foundation for a global project. Ben, could you speak to this?
Yeah, I would just add that I was thinking about the IRB piece of this, that there'll be a lot of work to do in terms of being thoughtful about research ethics and working with children and making sure that we have kind of proper consent and assent from the children themselves, from their caregivers. So that, I think that picks up a bit on the piece you were talking about in terms of interdisciplinarity, that in terms of my piece, I'm hoping I can contribute to that, to the IRB elements of this.
Can I just say one more thing? I've been getting a lot of wonderful feedback from my colleagues all around the world. I've done a lot of research internationally, and a colleague of mine who is Estonian and works on Estonian music said in 2009 in their big song festival, the slogan was, "When you breathe with others as one, your soul is there." And it just struck me. My own Fulbright was in the Baltic in Lithuania. And so there's something so beautiful about the idea of the breath together and how music grows out of that, but it comes back to that process of being and interacting, breathing, making music together. That's going to be at the heart, I think, of the intervention as it evolves.
Yes.
Well, God knows our societies need more of that at this moment. So thank you all so much for this really exciting work. And as you say, Heather, I completely agree that Northwestern is uniquely positioned to do this work. So we're really grateful to you for bringing it to us and excited to see what comes next. So just ask you, the group leads from this group, if you could just turn off your cameras and microphones now. And goodbye, see you soon. In addition, so we, those are our 3 big global working groups that we've just introduced you to. Now, in addition to those groups, we are pleased to share that we were able to offer global catalyst grants for 1 year of somewhat more limited support to 2 further projects. And so here to introduce the first of those projects is my wonderful colleague, Deputy Director of the Northwestern Buffett, Professor of Management and Organizations at the Kellogg School of Management, Professor Klaus Weber, who's played such an important role in this work. So Klaus, first, thank you to you and your team for all that you've done. Welcome.
Thanks. The first group that I would like to introduce is the Climate Crisis and Media Arts group. And this is a topic that is very close to my own interests, and so I'm very glad that I can say a few words. Addressing climate change is really one of the greatest and imminent challenges of our time. And the it's often the case that the very critical yet very abstract policymaking at the national and international level will probably not be enough to sustain the necessary action. And nor are scientific facts and reports, important as they are. And the reason is that our grasp of climate change at a very personal level is all too often limited by our own experiences and our own bubbles. And at the same time, because it is such a global crisis, action is often hampered by a sense of helplessness and thinking of this as a remote, overpowering challenge. And so the challenge that this group is trying to address is really how can we make climate change real as a lived experience, and at the same time understand the very different, very diverse life worlds and experiences of people around the world. And so this project is trying to make the climate crisis visible and personal and accessible, which I think is absolutely critical to getting action. It does so by harnessing the expressive power of the media arts and critical frames offered by the environmental humanities. And the group's work will lend voice to people living with various incarnations of climate change around the world, such as enduring forest fires in the American West, desertification in northern China, hurricanes and flooding in Haiti and India. Importantly, the group is also very committed to a non-hierarchical, non-European, American-centric mode of knowledge production, which I think is, again, very important from a global perspective. It's a very ambitious effort designed to create both multimedial medial content and develop platforms and networks that can propel us to acts that are international and global. So we're very, very proud to catalyze this group's work further. And you will now hear a more compact presentation about this fantastic effort from the group leads, Corey Burns and JP Snedecki. Corey is an associate professor of Chinese culture in the Department of Asian Languages and Cultures, and JP is an associate professor of radio, television, film. And so we'll play their introduction to their project.
Climate change denialism notwithstanding, more and more people in the United States and around the world have become comfortable thinking and talking about climate change and related environmental crises as existential problems, threats to human and non-human life itself. There's no shortage of scholarly work and media representations that frame these issues in precisely these terms, despite a growing awareness of the unevenly distributed impacts of climate change in the short and medium term. The fact that some people will be inconvenienced by it, whereas others will be and are already being displaced, dispossessed, and killed. This existential rhetoric is part of a larger speculative enterprise designed to affect change in the present by imagining a dire future just around the corner. We have to act now, we're told many times, before it's too late, or else our future might look something like this. As many scholars and activists have argued, the first person plural pronoun we that's so often used in discussions of climate change stakes an untenable and unethical claim to a shared experience of and vulnerability to climate change. Whether this persuasive rhetoric can succeed in mobilizing individuals, governments, and institutions to act despite its shortcomings remains to be seen. While our project on the climate crisis and media arts is invested in exploring alternative persuasive modes, what we propose is not another set of future-oriented speculative strategies, but rather scholarship and creative work centered on the everyday experiences of the many people already living on the front lines of the climate emergency. In place of an existential, speculative, and fictional we that erases differences of race, class, gender, and nationality, this project seeks your support in the creation of a multi-site, collaborative, public-facing, and interdisciplinary infrastructure that links and empowers vulnerable communities around the world by showing what it means to exist within an unfolding climate crisis. What does climate change actually look and feel like in urban Chicago, the rural Midwest, northern China, the US-Mexico borderlands, or coastal Southeast Asia? How does it intersect with and compound other pressing problems, including migration, economic inequality, and structural and institutional racism? What kinds of politics and what forms of action become possible when you reject the fictions of an existential we in favor of forms of community built not on shared experiences of a monolithic climate change, but on the sharing of differentiated experiences of climate crisis? Combining the expressive power of the media arts with critical frames offered by the environmental humanities and the rigor of climate science, this project seeks to influence cultural and political discourse on the climate crisis, not by speculating on unlivable futures, but by creating new ways of depicting what it means to live within a changing climate right now. With Buffett support, it will bring together artists, scholars, activists, and students in the pursuit of the goal of producing empowering, public-facing, and sensorial depictions of the material effects and lived experiences of the ongoing climate crisis in a range of sites and in collaboration with diverse communities. My name is Corey Burns, and I am one of the co-organizers of the proposed Climate Crisis and Media Arts Working Group. As a scholar of modern and contemporary Chinese culture and the environmental humanities, I've dedicated myself to the study of the complex interplay between spatial and environmental imaginaries and the material practices that have so radically reshaped the planet over the last 4 centuries. What makes this project so urgent to me is that it's designed to model new ways of thinking about and representing environmental crises as they unfold and at a human scale. The everyday experience of climate change has been a topic of creative interest to novelists and narrative filmmakers, but those of us who are still relatively insulated from the worst impacts of climate change know far less about the lived experiences of vulnerable communities. And I think we've done far too little to help empower those communities to share their own stories and experiences. The Climate Crisis and Media Arts Working Group is designed to address just these shortcomings and to develop creative, collaborative solutions to them.
Hello, I'm JP Snayadecki, an associate professor and the director of our MFA in Documentary Media program at Northwestern University, School of Communication, and with Corey, I'm a co-lead of this project. I'm excited to introduce you to members of our team. Lakshmi Padmanabhan, who views our Climate Crisis and Media Arts initiative as a crucial site of knowledge sharing and learning from the broader collective of artists, scholars, and activists who are working on similar questions in their own locales. Callum Walter, as an artist working in sound and moving image, he is thrilled to participate in a project that examines the relationship between media and climate emergency and addresses the existential crisis of climate change that goes beyond the extractive. Michael Metzger, media arts curator of the Block Museum, who envisions our working group as having a regular campus and public presence with quarterly screenings designed to showcase exemplary works of film, video, and media art that examine different facets of the climate crisis. Inez Summer, filmmaker and associate director of the MFA in Documentary Media program, whose latest documentary, Seasons of Change on Henry's Farm, tells the story of a Midwest farmer who struggles with the impact of a changing climate on his organic farm and shows that everyday people have agency and can take action locally. Dr. Joanne Liao, assistant professor at the University of Saskatchewan on Treaty 6 territory, as a participant from Canada who also has strong connections in Singapore and Hong Kong, Joanne is excited for how we might foster cross-border exchanges. For her, this project will represent a unique and innovative way to connect communities all over the world in a collective effort. Brett Story, a nonfiction filmmaker, human geographer, and assistant professor of image arts at Ryerson University in Toronto, who employs moving images to interrogate the production of reality and how it disguises the very forces that have led to our climate crisis. For her, the role of art is to reveal possibilities not yet apparent in the present landscape. Jason De Leon, as an anthropologist, MacArthur Grant recipient, and director of the Undocumented Migration Project, Jason is excited to collaborate with our Buffett Institute working group in order to bring the effects of the climate crisis to bear upon the experience of migrants and refugees from the Northern Triangle to the Mexico-US borderlands.
In year 1 of our project, we plan to organize a regular screening series in collaboration with the Block Cinema that showcases decolonial artistic strategies and modes of scholarship, to host campus workshops, conferences, and exhibitions that engage a range of leading artists, community members, scholars, and other experts whose work employs innovative practices and platforms to address climate crisis, to establish a virtual reading group that contextualizes the climate crisis as experienced in different places around the world, to design and launch an interactive website that will link geographically distant research sites, showcase user contributions, share knowledge, and amplify work and activism that's already being done in the communities with which we're collaborating, to offer courses at the undergraduate and graduate level related to the project, and finally, to leverage various professional activities, including festivals, conferences, and workshops to develop our networks. In year 2 of the project, we plan to continue our climate crisis screening and exhibition series, but also to create a podcast series that further amplifies the work being done by participants and our global collaborators. We also plan to support media installations and media arts performances on campus and in collaboration with students that highlight the climate crisis and our approach to it. Finally, we plan to support the creation of new works of media arts and scholarship in partner sites that address the climate crisis in innovative and collaborative ways. Given its embrace of innovative interdisciplinary research and its investment in linking Northwestern faculty and students to peers and collaborators around the world, Buffett is the perfect home for this project. We share your commitments, and we're eager to work together on the climate crisis and media arts working group. Thank you for your time and for your consideration.
Thanks so much to all of you in the Climate Crisis and Media Arts Group who've proposed this really innovative and obviously extremely timely project. We look forward to partnering with you on it. So now it's a pleasure to introduce our second and final Global Catalyst Grant recipient group. And this group is entitled Global Media Representations of Mental Health and Illness. It's led by Assistant Professor of Instruction in Global Health Studies and Anthropology, Peter Locke, Associate Professor of Anthropology, Rebecca Seligman, and Professor of Radio, TV, and Film, David Tolchinsky. And this group is focused on the ways mental health and mental illness are portrayed globally in global media, from film to television to plays to performance to social media. And also they're focused on creating new and different narratives about mental health in media. So the group has a wide-ranging project that includes both research about media and creating new media works. And we really we're inspired by the multi-pronged approach that they are taking. And they're really genuine investment in helping people think more deeply and differently about mental well-being. So you're going to hear now from Global Media Representations and Mental Health and Illness Group leads, Peter, Rebecca, and David.
Hello, everyone. On behalf of Rebecca Seligman, Peter Locke, and myself, David Tolchinsky, thank you for considering our proposal.
Here's the global challenge we see. We're awash in narratives about mental health. In film and television around the world, we see schizophrenic serial killers and those with dissociative identity disorder. We see autistic geniuses and soldiers with PTSD. More often than not, we're shown severe illness, and those with mental health problems are made to appear childlike, incompetent, and destructive. As artful and complex as many of these media works are, their depictions of mental illness are sometimes egregiously wrong, oftentimes sensationalizing, and frequently essentializing. Such depictions also always serve to reflect and reinforce dominant social and cultural tropes about mental health, illness, and the causes and responsibilities associated with them. What we rarely see are stories reflecting the broad spectrum of mental health, stories normalizing difference, stories about the structural causes of mental distress and the social barriers to well-being that exist. stories about the trauma and suffering that have resulted from histories of colonialism, anti-Black racism, marginalization, and alienation.
Global mental health has escalated as a major area of global health concern over the last few decades for a variety of complex reasons. It is featured in the Sustainable Development Goals and has attracted research and advocacy from across disciplines and new generations in particular. What's clear is that we have much yet to learn about the acute and unequal global burden of suffering and how best to address it. We share the perspective that medical, neuroscientific, and behavioral approaches are essential but insufficient on their own, and that far more attention needs to be paid to cultural difference, inequality, and the social determinants of suffering, including and especially the place of mental health in the media arts around the world. We each bring substantial experience, training, and commitment to these concerns.
In all of my research, I've explored the power of cultural scripts, narratives, and meanings to shape individual experiences of health and illness, suffering, and well-being. And I've documented the ways that such scripts can both constrain and transform experience. I'm passionate about this project because it represents a unique opportunity to use my expertise to help reshape cultural narratives and scripts about mental health through the power of the media, and to reach a much wider audience than I've ever been able to access before. As such, I see real potential to help people transform their own scripts and self-narratives in ways that positively influence their well-being, and to help intervene in the shared narratives and meanings that reinforce disparities and compound suffering.
As an ethnographer, I'm a passionate believer in the power of deep listening and nuanced storytelling to capture the realities of lived experiences of suffering and transformation across contexts and cultures. The arts and the humanities can produce powerful change in both people and societies without the applications of power entailed by behaviorist and medicalizing approaches. Through my years listening to war survivors and their caregivers in Sarajevo, I saw the painful limitations of both media representations and Western psychiatry in reflecting and addressing the complex realities of trauma and the agonizing struggles people wage to recover and keep on living. I'm passionate about this project for the unprecedented opportunity it provides to bring all of my commitments together, harnessing ethnographic storytelling in the arts, meaningful interdisciplinary collaboration, pedagogy with heart, and people-centered research to work toward a better world.
As a screenwriter and playwright, I am fascinated by depictions of mental illness and mental health. And a lot of the works I create and am drawn to watching, studying, and teaching have mental illness at their core. I've also been disturbed by what certain depictions can do, how they can shape the public's feelings and perceptions. And I'm aware that some of my favorite films use comedy and horror to depict mental illness. And those two ideas can and should go together. How do we use all that storytelling has to offer, drama, comedy, horror, documentary, fiction, film, or play, to create compelling, complex portrayals that will add to everyone's understanding? Beyond my work as an artist, I have a long history at NU of starting and running programs. As I do in my screenplays, I'm excited to put unexpected people, disciplines, and ideas together and see what new thing emerges. Our proposal has the potential for such innovation, but also the potential to heal and make the world a better place, and that's why it's so important to me. I also mentioned the programs I started to speak to feasibility. What we say we will do, including making sure this initiative grows and becomes self-sustained. We love the diversity of perspectives this project brings together. Already, we have committed interest from playwrights and screenwriters, anthropologists, a psychoanalyst, a neuroscientist, and an expert in web TV.
We're excited about all of the potential connections and synergies we can build with this project. Already, we have links and synergies with numerous Northwestern and Chicago area programs, organizations, institutions, artists, and scholars, as well as international institutions, scholars, and artists. We've already developed close ties, for example, with the National Alliance on Mental Illness in Chicago, Heartland Alliance in the Kovler Center, the program in transcultural psychiatry at McGill University, the Universidad Iberoamericana, Wings of Hope Sarajevo, the Prague Film School, and many more.
Our activities are detailed in our project overview and will include fostering unique interdisciplinary collaborations between researchers and artists around the critically important topic of mental health, designing team-taught courses, bringing together professors and students from a variety of perspectives around mental illness, commissioning substantial works from faculty and students, which will promote complex, nuanced portrayals of mental health, and bringing together artists and social scientists from around the globe who are all addressing this issue in a variety of ways.
New work from one of our team members, Erin Courtney, provides a model of the kind of work our collaborative could yield. Erin worked with neuroscientists at the New Right Collective at Columbia University, a group of scientists, writers, and media artists who collaborate to improve science communication. She worked with them to develop a play about neuroscience, trauma, and selfhood, titled Anne, Fran, and Marianne. Our artists and scholars will work together in a similar way to create a better representation of mental health. It's also noteworthy that via our Buffett workshop series, Erin and I discovered a shared interest and expertise in narratives about traumatic dissociation and selfhood, and are already planning a future collaboration, including a plan for me to interview Erin about her play for an event later on this spring.
So Erin's work gives us a model for the kinds of unique collaborations we hope to achieve, but at a global scale, bringing social scientists and artists together around the issue of more robust depictions of mental health and illness. And to underscore, this is not just an interesting idea. Mental health is an urgent global issue directly connected to Sustainable Development Goals 3.4 and 3.5. Current media representations often perpetuate stereotypes, cause trauma, and can potentially lead to violence or death. Anecdotal evidence points also to mental health as being a focus for the Northwestern community. Some suffer from mental illness, some resent being labeled as mentally ill, and many are interested in working on issues surrounding mental health and illness as either researchers, media makers, or teachers. Finally, the substantial gift by the Pritzker Pucker Foundation to establish the Studio Lab for the creation and promotion of mental health speaks to local and global support for this kind of project and paves the way for a university-wide approach. The Studio Lab will center on undergrads and narrative films. Our project will focus on scholar-artist partnerships, international and local community perspectives, and social determinants of mental illness.
Our long-term vision is for Northwestern to become an internationally recognized leader in studying the social causes of trauma and mental illness, and in promoting the creation of nuanced and complex portrayals of mental health in media. Above all, we hope to contribute to making the world a kinder, greener place in which all stigma has been removed from mental illness, where those who need help are getting it, and where the social determinants of mental illness are acknowledged and, wherever possible, extinguished.
Thank you. Thanks for your attention.
Thank you.
Thank you.
Thank you so much, David, Peter, and Rebecca, for this incredible project. I think all of us have an understanding of how important this work is, especially this year, and a hope that universities can really make important, impactful change in this space, and Northwestern, above all, seems positioned to do so. So super excited about what's to come. So to all of our faculty who are joining us today, we hope that you will come to us with your idea for how we as scholars, as thought leaders, can come together to address an issue of critical global concern. And so our process is beginning again right away. And we're going to close by my turning it over to Deputy Director Klaus Weber to tell you a little bit about how you can get involved. Before I turn over the mic to Klaus, I just want to thank everyone once again for joining us today, and especially to offer our tremendous thanks to Roberta Buffett Elliott, and for making this work all possible, and for joining us today. And to all the researchers and all the thought leaders who participated in all of the meetings and processes that brought us to today, as well as our judges and all of the remarkable, remarkable team at Northwestern Buffett who worked so hard because they believe so much in the impact that universities can have if we only join forces together. So thank you to you all, and Klaus, thank you to you. And let me turn it over to you now.
Thank you, and I will be brief since we've heard the most exciting part. Let me just echo Annalie's gratitude for all of those who made it possible to put this together, and my main thanks really is to the Northwestern faculty, for those who participated in Idea Dialogues, the workshop participants, the group leads, because without you, none of this would be possible, and the people that participate in this process, they take risks, they get outside their comfort zone, and they oftentimes don't quite know what they're getting themselves into, and that's the beauty of it. I think that's what makes it powerful. So for us, of course, this is just the beginning, and what you saw today is only really scratching the surface of all the pressing global questions and problems. And so we really want to invite any and all Northwestern faculty to bring their ideas to us. For those outside of Northwestern faculty, to bring your ideas to us, because we would love to organize idea dialogues, to create new groups that extend this work, come up with new and exciting ideas. And it doesn't have to be a very well articulated question or mode of inquiry, just a hunch, a question, something where you feel something should be done about this, or this is really vexing. And we would love to work with you. What you see on the slide is our timeline for this coming year. This process runs on an annual cycle. So we'll start with idea dialogues, which is the first stage of this process that just brings groups together basically right away. So May is the starting date, and we run those throughout spring into summer and the fall quarter. The workshops for groups that want to apply for funding will be again held in the winter quarter, January to March. And then we will have another funding round and another showcase like today in April. So this is a program that we hope to further expand, and we're really inviting any submissions, any ideas. Also, if anyone is interested in connecting with our working groups or Global Catalyst Grant recipients, please reach out to us, to Ariel Schwartz, who's our Associate Director of Research, or to Annalise or myself. We'd love to talk to you and explore new ideas. That's all I wanted to say for closing. So thank you very much for all of you who have attended. For all of you who've made this a very successful year for Buffett, and we hope to see you again very soon.